Hi, this is Ira Flato, and you're listening to Science Friday. Today on the show, experts have been promising new effective drugs designed by AI. So, where are they?
We have nothing actually on the market that can be attributed in any way directly to AI. So something has gone wrong. It's overblown expectations.
With AI basically everywhere these days, there's debate about how useful generative AI actually is. But one area where experts think it could be game changing is scientific research and speeding up major discoveries. One of the fields that experts think is ripe for this application is drug discovery, an expensive and time consuming process. It can take decades before a drug comes to market. But so far, there's great disappointment. The few AI designed drugs that have made it to clinical trials haven't been approved, and what was once a hot space for venture capital investment has cratered in the last few years, and many startups have shut their doors. So, why exactly has it been so hard to make AI designed drugs? What are the fundamental issues? What does the future of this space look like? Here with some answers is Dr. Peter Coveney. He's the director of the Center for Computational Science in University College of London's Chemistry Department. He studies how chemistry discoveries can be sped up with algorithms and computers. Peter, welcome to Science Friday.
Thank you very much indeed.
You're welcome. Before we get into the challenges, can you walk us through normally how drugs are made the old-fashioned way? Why does it take so long? Why is it so expensive?
It's a big challenge. We would like to understand how the body works to design drugs correctly. We don't have all that knowledge with us today. So we have to do what's the next best thing, and that's to start with the most efficient way of getting a drug out that works for the maximum number of people. That's the magic bullet idea, that one drug fits all, and that's the approach that the pharmaceutical companies adhere to today. Let's try and get a drug that will apply to everyone. That's not likely to work very well because we are all different. So there's this challenge between understanding how individuals react to drugs and the...
Hi, this is Ira Flato, and you're listening to Science Friday. Today on the show, experts have been promising new effective drugs designed by AI. So, where are they?
We have nothing actually on the market that can be attributed in any way directly to AI. So something has gone wrong. It's overblown expectations.
With AI basically everywhere these days, there's debate about how useful generative AI actually is. But one area where experts think it could be game changing is scientific research and speeding up major discoveries. One of the fields that experts think is ripe for this application is drug discovery, an expensive and time consuming process. It can take decades before a drug comes to market. But so far, there's great disappointment. The few AI designed drugs that have made it to clinical trials haven't been approved, and what was once a hot space for venture capital investment has cratered in the last few years, and many startups have shut their doors. So why exactly has it been so hard to make AI designed drugs? What are the fundamental issues? What does the future of this space look like? Here with some answers is Dr. Peter Coveney. He's the director of the Center for Computational Science in University College of London's Chemistry Department. He studies how chemistry discoveries can be sped up with algorithms and computers. Peter, welcome to Science Friday.
Thank you very much indeed.
You're welcome. Before we get into the challenges, can you walk us through normally how drugs are made the old-fashioned way? Why does it take so long? Why is it so expensive?
It's a big challenge. We would like to understand how the body works to design drugs correctly. We don't have all that knowledge with us today. So we have to do what's the next best thing, and that's to start with the most efficient way of getting a drug out that works for the maximum number of people. That's the magic bullet idea, that one drug fits all, and that's the approach that the pharmaceutical companies adhere to today. Let's try and get a drug that will apply to everyone. That's not likely to work very well because we are all different. So there's this challenge between understanding how individuals react to drugs and the population as a whole. So you will try to find the one molecule that you think fits into a target protein and then kills off some disease. That itself still takes a lot of time because you have to first be clear what the target protein is, and then the search for the magic molecule starts to take place. Now, you focus so much on that single property that it's rather later on in the process that people start to worry about other aspects of how the drug candidate will work. There may be side effects to that drug, and then you put it through several stages of clinical trials, and indeed the magic bullet may fail late on in the procedure when you're really testing it on a lot of humans and you find that it's just not effective, or worse, has deleterious impacts. And at that point you would have to abandon the drug, and that's a late failure. And at that stage you've spent many millions, if not billions of dollars on the development, and you may have taken 10 years. So it just fails very easily. On average, far less than, let's say, 10% of the attempts that people make to design a drug actually make it through to market. It's a very slow and sequential process, and it's hidebound by regulatory procedures that have to be met at each and every stage imposed by things like the FDA.
Mm-hmm. And how are researchers hoping to change all of that with AI?
So what everyone is trying to do is to remove the lengthy and time-consuming, labor-intensive experimental efforts. So if you can come up with something that's in silico, meaning on a computer, that makes reliable predictions before any experiments need to be undertaken, that should short-circuit the time of developing the drug. Now, the current hype is around artificial intelligence being able to do that, and that's predicated on the idea that these techniques are extremely powerful and as applicable to each and every problem that we have to face in our world. So drug discovery is only one of those, but the idea is that somehow, armed with enough information and data on the disease case, the protein you're after, and candidate molecules, you can race through and test which ones are going to be most effective with great speed using an AI system. It will have to have been trained with an awful lot of data that's reliable in order to be used in the way most people think of it. And after it's been trained, you just present the input that you're looking for, which of these candidate molecules will bind best to the target, and it should hopefully spit out the answer often in seconds at that point. But what's at risk here is an illusion of thinking that all we need to do is find the magic bullet at the start and then we've found the drug. That's in a way only the beginning, because you then have to subject that candidate molecule to lots of tests that end up also in the clinical trial stage, and the failures can occur late. Now, AI is particularly good at doing searches over huge, we call them libraries, and we might be talking about many billions of molecules that it can go through very quickly to see if it can find what we call hits, meaning the molecule looks like it's got a good geometric fit inside an active site on a protein. That part of the problem can certainly be done pretty effectively with AI, but that's really only the very first step in the process. And the reason for that is that we really need to have a good understanding of the mechanisms by which molecules interact with proteins. We can't just find the answer by looking things up in an existing database.
Very interesting. Let's talk about some of the businesses of these companies Can you tell us, for example, what happened to a company called Benevolent AI? It seemed like this was a big name in the space.
Hey, it's Laura Lichtman, and you're listening to Science Friday. Today in the show, how a mega popular reality show upended what scientists thought they knew about metabolism.
I was interested in participating as a researcher, observing these folks who were doing this sort of natural experiment, a study that couldn't have been done otherwise had they not already been signing themselves up for this kind of abuse on a national television show.
Remember The Biggest Loser? That show where people tried to lose as much weight as quickly as possible for a big cash prize. The premise of that show was that weight loss was about willpower. With enough discipline, anyone can have the body they want.
Do not be sloppy. Finish this strong, Joel. No, Joel, don't do it. Don't do it.
After the break, it might seem that using personal data to train AI might be helpful for treatments, but there are some drawbacks.
The idea that you can use the clinical trials coming from Western sources to reliably predict how to treat patients in India seems a flight of fantasy.
You know, Google has a startup called Isomorphic Labs for developing AI-designed drugs. And their chief AI officer, Max Jotterberg, recently said on the Star Talk podcast that the entire drug development industry needs to change how clinical trials are done, that they take too long, that mouse models aren't very predictive of human success. What do you think of that?
Now, I think this is a really good issue and point that he's raising there. The future of medicine as a whole, it's part of what I would call building digital twins, because what we want, if possible, is not only to have in silico developments of the drugs, but also to be able to do in silico clinical trials as well, instead of taking these absolutely reliable computer-based models of relevant parts of the human body. Well, it seems sensible to many of us to use the simulation methodologies there with patient-specific data on humans rather than using animal models. Indeed, we know in numerous cases now that if we do this, replacing animal models by human data, that the in silico trials tend to be a more reliable guide to success in the future.
Yeah, because animal models are not really that accurate, are they, at predicting success in people?
No, they're not. And sometimes they're totally misleading. And what's more, this is also true between humans, because humans are very diverse and their own responses to a given drug can be completely different. So that's in the end why you want a clinical trial. Having worked up this magic bullet, you try it out on many people. If it's a successful one-size-fits-all drug, typically it only really works well for about 50% of the population, and you hope the other 50%, don't get deleterious effects caused by them. But certainly in areas like cancer, many of the drugs that do work on far fewer than 50%. It can be 10% or less of the population, because they depend specifically on something that might relate to the genome of those individuals. So what you really want is some in silico representation of a group of people in a clinical trial that you can actually test these drugs on virtually initially, because that not only eradicates animal testing, but in the first stage also anyone who volunteered in this way would only be giving their own data and putting themselves at no risk at all.
So where do you get all the data that the AI models need, all the data from people that you want to feed in to the AI?
If we're talking now about clinical trials and so on, what we rely on is typically, shall we say, in the Western world, all the clinical trials work that has been done over decades and so on, provides databases that can then be used in the way you're getting at. The problem with those is they're clearly very biased, as they do tend to still, at the moment, be dominated by white males. Is over there. I discovered that in India they haven't really cracked doing clinical trials themselves, so their clinicians and doctors still lean on Western data sets in order to predict things for their patients. India, you may realize, is an incredibly heterogeneous country, so the idea that you can use clinical trials coming from Western sources to reliably predict how to treat patients in India seems a flight of fantasy. AI has a role there because the amount of data you can end up with on individuals is a lot too. And AI can be very powerful with population health issues too. But if you're trying to treat the patient in front of you, you need to know the details of that patient, not a statistical sort of average given by an AI system.
Mm-hmm. So let's talk about the path forward. If you had a magic wand, if I could give you a blank check to do everything you'd like to do, what is the path forward you would see for AI helping in drug discovery?
I would see its role along the lines we said earlier. It can contribute, and I say it already does. It's not fulfilling the bold claims that it's discovering drugs right, left, and center, or reducing time to solution to a couple of years from 10. Possibly it's shaving off the time to solution from 10 years to 9. There are some arguments in that case. So its generic capabilities are useful throughout those workflows. Right. So there's two things here. It's a bit like weather forecasting versus predicting where the climate is going. Weather forecasting is good over a short period of time. Climate is about decades to centuries. And in the human body, there's the need to take action under some often emergency or short-term conditions. That's like weather forecasting. And the wellness thing is predicting into the longer term. That's more challenging, but that's the way we expect things to evolve in the long term.
Seems like a lot to bite off and chew here.
Yes, there's a huge amount that is there to be done. We're not going to just suddenly solve this with one technique. I would say that the challenge here is we haven't said much about what doctors and clinicians think of all of this, and it is a radical transformation in how we approach medicine, which isn't really gaining traction in most medical schools yet. But I do notice that students who are doing medicine today are really trying to push their profession more in the direction of using predictive software, AI tools, coding, and trying to model things. So I think for the longer term, this will gain momentum.
Well, we will keep watching it with you, Dr. Coveney. Thank you.
With Instacart, you get groceries that over-deliver. Like when you get groceries that are the same price as in-store. With no markups at select retailers, you get in-store products for in-store prices. And the only thing that isn't in-store is you. That means you could order in-store products at in-store prices while you're in sweatpants, in spin class, in stuffy work meeting, in anywhere but in-store. So download the app today and get $0 delivery fees on your first 3 orders. Instacart. Groceries that over-deliver. Service fees, exclusions, and terms apply.
Hi, I'm Ira Flato, and this is Science Friday. Today on the podcast, 100 years into quantum science, and it's still really weird. But is the weirdness true?
It's not that they're really particles or really waves. They're really a third kind of thing that has some characteristics of each. And that's not like anything we experience in the world around us, which is why the whole theory seems strange.
100 years ago this summer, physicist Werner Heisenberg wrote a letter to Wolfgang Pauli, and in it he revealed his new ideas about what would eventually be known as quantum theory. And 100 years later, that theory has been expanded into a field of science that has revolutionized the way we look at the world around us, from the ultra small to the ultra big, from subatomic particles to the makeup of the universe. But it's still really weird and often counterintuitive. Here to help us celebrate 100 years of quantum science and separate quantum fact from science fiction is Dr. Chad Urzell. He's the R. Gordon Gould Associate Professor of Physics and Astronomy, also chair of the department at Union College in good old Schenectady, New York. Welcome to the program.
Thank you for having me on.
Okay, 100 years, but what actually are we observing and celebrating in detail?
So Heisenberg is really kind of a late stage in the early development of quantum. Really, it's in some senses the 125th anniversary of which was Max Planck in 1900, who was desperately trying to explain the color of light from a hot object. And he had to resort to this weird mathematical trick to make the equations work out, where he essentially assigned an energy to the frequency of light. And a few years later, Einstein picked that up and ran with it. Planck always thought it was an ugly mathematical trick. Einstein took it seriously, ran with it. And then around 1913, Niels Bohr proposed a quantum atom, sort of the cartoon solar system atom that you see in children's books and that sort of thing, with electrons going around the nucleus, which works brilliantly for hydrogen, but it's kind of hard to make work in detail for anything else.
Well, if this all happened 125 years ago, why are we celebrating 100 years ago?
So by the mid-1920s, it had gotten sort of untenable. People realized that what they were trying to do with the Bohr picture of the atom wasn't really working. And Heisenberg is one of the people who really sat down and said, okay, let's go back to basics and think about what really can we say about this, and realized that it didn't make sense to talk about the electron following a definite orbit, but he had to talk about just what you could measure. And that is the first complete mathematical formulation of quantum mechanics.
So what are the basic principles that make up quantum theory? I mean, I want you to sum it up in 25 words or less.
So the basic idea is you can think of everything in the universe as having both particle-like character. You can count things, you can detect things at a particular instant in a particular position, and also some wave-like characters. They're sort of distributed over space. They're delocalized a little bit. They interfere with each other if you allow them to take two different paths, and that gives you this weird combination of properties. It's not that they're really particles or really waves. They're really a third kind of thing that has some characteristics of each. And that's not like anything we experience in the world around us, which is why the whole theory seems strange.
You know, so many of the ideas that come out of quantum theory just seem so weird. Stuff can pop out of empty space. You have two particles that can be linked across space. Entanglement. Do we know how real these effects are?
The fascinating thing is all of these things are absolutely and verifiably real, right? The idea of entanglement, that's Einstein's last really great contribution to this debate. This notion of it being problematic that these particles can be correlated across distance in ways that seem to violate relativity. A guy named John Bell in the 1960s showed that there's an experiment you can do to test whether that non-locality is real. And people subsequently went and did those experiments. And every time this has been tested, the result is very clear that the sort of theory Einstein preferred is ruled out. And the quantum theory, where these things are correlated across space and time in ways that seem to defy our intuition, is absolutely true.
When Einstein called it spooky action at a distance, was that pejorative? Was he making fun of the idea?
He was talking about the notion that things could change instantaneously over a wide area of space. And he found that idea really ridiculous and outlandish, as something that simply couldn't be allowed. In large part because he had spent so much time with the development of relativity, working out exactly the restrictions on, sending information through space and the relationship between space and time. And something that goes against that was really offensive to me.
Well, that was the idea that light is a constant. Nothing can go faster than it. How could spooky action at a distance, how could something so far away react instantaneously?
Exactly, and that's that.
Was there an answer to that?
The modern understanding is that this very definitely does happen, and then there's questions about how you interpret that. What do you say goes on inside the box, right? We can do these experiments, and we see that you have a particle in Vienna and another particle in London, and you measure them very close together in time, and their properties turn out to be extremely well correlated. But why that is open to debate. Some people say it's really all just about information. It's all we're doing is we're learning things about what we know about the outcomes of measurements. Other people say that there is some weird sort of collapse that happens that doesn't respect the boundaries of space in the way that we normally think of, and that we just have to deal with it.
After the break, trying to test and extend the rules of quantum to the macroscopic world, does it work?
One of the open questions is, how far can you push that? Can you get to, things the size of red blood cells? Can you get to bigger than that?
If these early papers that we're celebrating again 100 years of now, if they were the introduction to the field, and even going back, as you say, 1900, 1910, 1920s, if they were the first chapters of a quantum physics book, let's say, what chapter would you say we are in now?
I would say sort of your Planck Einstein is kind of chapter 1. The Bohr old quantum theory is 2. What we're celebrating is really the start of chapter 3, and then I would say there's probably 3 more after that. There's sort of the solidification of quantum theory and the development of QED in the 1950s. Kind of 60s and 70s, you get the particle physics revolution and the development of the Standard Model, which is really closed off with the discovery of the Higgs boson in 2012. But the basic framework is really pretty well nailed down by the mid 80s. And then kind of 80s, 90s up into today, you get these experiments where we have the ability to control the states of atoms and light with sufficient precision that we can start to really probe these bizarre quantum things. And that leads to things like quantum information science and quantum computing that are some of the most exciting things going now. And I think that's kind of its own chapter, the ending of which hasn't been written yet.
So that's the frontier now, is what you're saying.
Where we're at now is sort of a combination of getting these applications of the weirdness, right? The things that allow you to do kinds of calculations quickly that you wouldn't be able to do with a standard classical computer. That's really one of the great frontiers of this. Another where it kind of brings in general relativity is the notion of trying to reconcile quantum mechanics with general relativity, which is an incredibly hard problem.
Are there limits to how big the thing quantum rules apply to? Can it govern big things above?
Hey, it's Laura Lichtman, and you're listening to Science Friday. Today in the show, a mega popular reality show upended what scientists thought they knew about metabolism.
I was interested in participating as a researcher, observing these folks who were doing this sort of natural experiment, a study that couldn't have been done otherwise had they not already been themselves up for this kind of abuse on a
The Biggest Loser, that show where people tried to lose as much weight as quickly as possible for a big cash prize. The premise of that show was that weight loss was about willpower. With enough discipline, anyone can have the body they want.
Do not be sloppy. Finish this strong, Joel. No, Joel, don't do it. Don't do it. Dig, Joel, dig.
The show had issues and it hasn't aged well. And while the weight loss landscape has gotten more complex with GLP-1 drugs like Ozempic and Wegovy, a social media-fueled wellness industry, infinite fad diets, the underlying idea that weight loss and health is as simple as move more, eat less hasn't gone away. But does that match current research? How has our understanding evolved? A new book written by a journalist and a nutrition scientist who, among other things, studied Biggest Loser contestants, breaks down the science of nutrition and metabolism and what we've learned in the 2 decades since that show premiered. The book is called Food Intelligence, and I want to bring on the authors. Dr. Kevin Hall, nutrition scientist and former NIH researcher based in Kensington, Maryland, and Julia Belluz, science journalist based in Paris. Welcome to both of you to Science Friday.
It's a pleasure to be here.
Thanks for having us.
Okay, let's start with this. What is food intelligence?
Well, the title's really a play on the idea that people really have a pun intended hunger for knowledge about what it is that they're eating and how it works inside their bodies and what it means for health. And so the idea of the book is to provide people with the necessary background about the science of nutrition and metabolism and give them some intelligence about the foods that they eat.
Is the idea that we are all born with a sort of innate understanding of what our body needs?
This was, as a layperson, this was one of the most surprising things in reporting this book, that we are all as living things equipped with this symphony of internal signals that guides our eating behavior to a much greater extent than many of us realize. And what we found in the book is that modern food environments have interrupted that system that has served humanity quite well many, many thousands of years. Exactly, yeah, the kind of foods that in particular are surrounded by now.
Julia, what drew you to write about nutrition and food?
So I'm someone who's struggled with my weight. I was a chubby kid and teenager, and my weight fluctuated up and down, including having obesity. So I'm someone who struggled with my weight, and I'm Canadian, and when I moved to the US, there was this time when obesity rates were soaring as they are now, and I became curious, why is it that so many people are like me? They seem to know what they should be eating, they want to be eating better, but they can't, or they struggle to. And in that reporting, I got to know Kevin, who was doing this fascinating research on kind of many different areas of nutrition science. And when I would talk to him, so much of what he was saying was so disconnected from where the public conversation was at. As it is now, there was a lot of conversation about fad diets or supplements or various supposed panaceas for people's weight and diet struggles. And then when I would talk to Kevin, that the solutions were really different. It seemed like bariatric surgery was the only effective tool we had for dramatic and long-term weight loss at the time. The GLP-1 drugs were already coming onto the scene. They were being used for diabetes, and people were seeing weight loss in those trials. But the public conversation still fixated on these kind of individual hacks and fixes that scientists like Kevin appreciated for most people in the current food environment just didn't work.
Kevin, I want to talk about some of your research. I mean, you worked at NIH a long time, but there's this interesting Eddie, your resume, where you worked as a scientist on set on the TV show The Biggest Loser. What were you doing?
Yeah, so that's while I was still at NIH, and I was really interested in understanding what was happening to these folks. This was a very strange lifestyle intervention that was televised on national TV for many, many seasons. And these folks were, subject to a whole lot of abuse, but in the space of that abuse, they were doing a ton of exercise, different kinds of exercise. And it wasn't clear how that crazy lifestyle intervention was influencing their bodies in terms of how much of the weight that they were losing was coming from body fat versus muscle, for example, or whether or not their metabolism would slow down, as typically with diet programs that don't involve a lot of exercise. There was a lot of discussion back then that exercise would boost metabolism and therefore you wouldn't experience the usual metabolic slowing. So I was interested in participating as a researcher, observing these folks who were doing this sort of natural experiment, a study that couldn't have been done otherwise had they not already been signing themselves up for this kind of abuse on a national television show.
What did you learn?
Yeah, we learned that many of the things that we had presumed about exercise and about metabolic slowing didn't turn out to be true. So despite the fact that these folks were engaging in roughly 3 hours of vigorous exercise every day of the week, their metabolic rate did slow down by as many hundreds of calories per day on average. But maybe most surprisingly, it was the folks who had the greatest slowing of metabolism who lost the most weight. And this was a trend that we saw kind of 6 years later when we brought these folks back to the NIH Clinical Center to study them 6 years after the lights of the television cameras turned off. Most folks had regained most of the weight, or at least 2/3 of the weight that they'd lost on the program. Some people regained all of it and more. One person continued to lose weight, and one of the things we were interested in was whether or not the metabolic slowing at the end of this crazy competition predicted who would regain the most weight, as had been assumed to be the case in previous hypotheses. And again, we had a surprise that there was actually no relationship between the folks who had the greatest slowing of metabolism after weight loss and the subsequent weight regain. And in fact, once again, 6 years later, the ones who were most successful at keeping the weight off, they boasted the slowest metabolisms.
What does that tell us about our understanding of metabolism?
Well, it tells us that metabolism isn't driving the cart here, right? It's actually something else that it's following. It's more the cart than the horse, and I think that's a new way that we are beginning to think about this. It's not determinative of body weight change in the way a lot of people like to think when they say, "Oh, I just have a slow metabolism, and that's the reason that I might be heavier than I would like to be." It's more complicated than that, and in fact, the metabolism seems to be responding to the lifestyle interventions that these folks had experienced, and it responds in proportion, so that if you do more changes in your diet and exercise, metabolism will respond, but you'll also receive the greatest amount of weight loss or maintenance of weight loss.
So it's not the metabolism that's driving the weight loss, is what you're saying.
Right. The way that we say it in the book is, it's not metabolism, stupid.
Perfect. That's right at my level. Thank you, Kevin. Julia, in your quest to better understand metabolism, you hermetically sealed yourself into a metabolic chamber. Please tell us about this experience.
So part of this quest that I had to understand, why was I a person who struggles? Why do so many of us struggle with our body weight? The first place I actually turned was having my metabolic rate measured in this metabolism chamber at NIH. And I was quite sure that this must be one of the reasons. I was someone who had, found it difficult to keep my weight down and had to put a lot of conscious effort into it. And as it turns out, my metabolic rate was completely normal for someone my age, gender, and body size. So this did not explain anything, and that obviously led to more questions than what was it. And in the process of reporting on the book, I had my genes analyzed as well, and I found out I am at a much higher risk for both obesity and diabetes than most of the population. But all the researchers I spoke to, including Kevin, said, genes for most conditions, they're also not determinative unless you have, like a rare single gene disorder or something.
We have to take a break, but don't go away, because when we come back, how much protein should we really be eating?
For most folks, they already get pretty close to double the recommended daily allowance.
Vermont listeners will be in Burlington on Friday, October 17th for a live Science Friday stage show. We're digging into the future of food, and we'd love to have you at the table. Join us. Tickets are at sciencefriday.com/Vermont Live. We also had tons of questions from listeners who had just many queries about nutrition and diet. So let's go to the first one.
This is Mary Kay. I'm calling from Florida. I'm 73, and there's a lot of information about how much protein I really should be eating to not be losing muscle mass and all those good things. I would love to know what the really latest information is on how much protein we need at different ages. Thanks so much. Love your show.
So that's a really interesting question, because I think that the amount of protein that people should be eating very much depends on the stage of life that they're in, and whether or not you should be worrying about it also depends on the stage of life. So for example, in folks who are older, who are likely to be in settings that have reduced protein availability and are at risk for losing a lot of muscle mass, then people seem to think that increasing the amount of protein from the recommended daily allowance is a good idea. We talked to a protein researcher in reporting for the book, Stuart Phillips, who makes a very poignant case that folks who are elderly and in institutional settings in particular are particularly at risk for losing muscle mass and losing mobility, and he recommends that people eat double the recommended daily allowance. For most folks, they already get pretty close to double the recommended daily allowance, and they shouldn't be worried too much about the protein content. If you're worried about muscle mass, and this is true across the board, the best thing that you can be doing is resistance exercise.
Pick up some weights. Is that what I'm hearing?
That's exactly right. Pick up some weights, get active, do some of that work, because that's going to have much more bang for your buck than any increases in these protein supplements in particular that people are using.
Like, I don't need to have a protein cold foam from Starbucks.
Not likely. Not likely. It's probably defeating the purpose with all the sugar and whatnot that's probably being added to it.
We got another related question from Nicole in California.
I've heard that if you just eat a lot of protein and you don't use it through exercising or moving your body, that it just turns into fat. Does protein turn into fat if it's not used?
Yeah. So I mean, I think this is part of the idea that well, number one, the protein that you eat is being broken down in your gut and is being used. Those kind of building blocks, those amino acid building blocks, are being used create other proteins inside your body. It's not just about muscle, and it's not just about powering muscle. Certainly, that was the debunked idea from the 19th century. The idea here is that you can overeat protein, and that protein that's not being used will be essentially those will be used to fuel metabolism. If you're eating excess calories, certainly you will then gain body fat. And we outline the pathways that happens in the book, and some of the really interesting shifts in the fuels that the body is using when you're eating protein and fat and carbohydrates in the diet, and how that all works out in the end to, if you're overeating calories, and those extra calories end up as body fat.
You know, we get a lot of questions about fad diets, and it feels like every diet has some special formula of fat, carbs, protein that we should be shooting for. Are there actual guidelines backed by science that work for most people about the correct ratio of those food groups?
Yeah, no, one of the things that people get confused about is that typically there's this ongoing back and forth debate about the evil nutrient, right? Protein seems to have been mostly spared in that discussion, but whether or not it's the dietary fat that makes you fat or the dietary that are making you fat seems to have flip-flopped depending on whether or not low carb or low fat diets are the most popular fad diet of the